Thank you so much, Rupa, and thank you, Cyrex Laboratory, for this special class and very special group of people, the participants. I'm going to talk about synergy between systems immunology and precision medicine and its connection to precision health, which is our ultimate goal. So our learning objectives, together we are going to learn in this special class about how systems immunology and precision medicine complement each other by looking at the immune system as a whole and recognizing that everyone is different from each other. We are going to learn how individual differences mean that medical testing, care, and treatment have to be personalized. We are going to learn that gut dysbiosis and or imbalance of the immune system can lead to autoimmunity and many, many other disorders. And finally, we are going to learn that personalized lymphocyte map, lymphocyte subpopulation, and antibody test results can contribute greatly to precision medicine. So what is systems immunology? Systems immunology is a major component of systems biology. Strategies for measuring a broad range of immunological assays as a means of discovering previously unknown relationships and phenomena, and as a powerful way of understanding the immune system as a whole, connecting the dots with each other. That definition was taken from this article published in Trends in Immunology, making human immune system more interpretable through systems immunology. And in this article, it is stated that one of the major goals of systems immunology is to increase the predictability of the immune system, early detection, thus contributing to the advancement of personalized medicine and the development of clinical therapies. Very well said. So systems immunology includes, right in the middle, humoral immunity, cellular immunity, mucosal immunity, and of course, as part of the immune system, we have the innate and the adaptive immune system. So all these dots that you can see around in here in this figure, it's in about lymphoid organs, the tissues, lymphoid organs, cells, mediators, and so even simple tests such as white blood cell count by looking at neutrophils, eosinophils, basophils, platelets, even red blood cells, and then more specialized testing, such as lymphocyte map, looking at T cells, B cells, CD4, CD8, Th1, Th2, Th17, Treg cells, and then natural killer cells. All of that play together to protect the body against the foreign materials. So when one type of cells will be increased or decreased, is going to affect the other components of the immune system. So this is about systems immunology. All parts of the immune system are interconnected with each other. One of the best examples that I would like to show you in this article, which we published in the journal NPG Aging. But before that, let me give you some introduction. Between 2020 and 2024, so far, I had the honor to publish about 15 different manuscripts in scientific journals in collaboration with different scientists from all over the world. And you can see the names in here, from Brazil, Germany, France, Russia, Israel, America, and many more. So here my name right here, and this is my son's name. So originally we started with taking sera or collecting sera from patients with COVID with different severity. And then we measured antibodies against 80 different tissue antigens. And then we found that sera from patients with SARS-CoV-2 reacted with 25 out of 80 different tissue antigens involved in autoimmune disorders. However, in this article, the focus is on two major antibodies, cardiolipin antibodies and platelet glycoprotein, which these two antibodies usually are detected in cardiovascular autoimmunity. But the biostatistician in our group was able to take just these two antibodies, connect them with severity of COVID. So the higher the antibody against cardiolipin and platelet glycoprotein, the more severe patient had more severe symptoms with COVID. And finally, the biostatistician connected the dot to aging. So the higher the age of individuals, the higher antibody level. So as you can see, the article is about a systems biology approach by connecting the dots between autoantibodies with severity of the disease as well as aging. So this is one of the example of systems biology approach and or systems immunology approach to research. About 3 months ago, I had the honor to participate in the 14th International Congress of Autoimmunity in beautiful Ljubljana, the capital of Slovenia, where I had the honor to present 5 different articles or 5 different presentations with my colleagues. But also, I did participate in many other presentations. And I loved this. That's why I decided to present this slide to you, that autoantibodies and precision medicine. One more time, they define what is precision medicine, aims at an individualized approach to prevention, diagnosis, and treatment by defining groups of individuals with similar characteristics. And then emphasis on autoantibodies. Autoantibodies are traditional biomarkers for autoimmune diseases and can contribute to precision medicine in many aspects, including identification of the individuals at risk, disease subphenotyping, and prognosis and guide in treatment for different patients. Another article in Frontiers, I think it's Theology, Precision and Personalized Medicine, what their current definition says and silences about the model of health they promote, and then implication for the development of personalized health. The US National Human Genome Research Institute defines precision medicine as follows: an innovative approach that uses information about an individual's genomics, the gene, plus the environmental factors and lifestyle information to guide decisions related to their medical management. And the goal of precision medicine is to provide a more precise approach for prevention, diagnosis, and treatment of diseases. And ladies and gentlemen, for us, part of the functional medicine, this is not new, because Dr. Bland, almost 10 years ago, started the institute, PLMI, personalized and lifestyle medicine. So we were way, way ahead of these publications, but it's good to see that the world is catching up with us. So this is how I see at Cyrex, what is precision medicine model? At its core, precision medicine is the intersection between people, their immune system, their environment, the changes in their markers of health and illness, and their social and behavioral factors over time. So this is very well summarized in here, that genes, gender, age, demographic, the exposome factor, the external environmental factors, food, toxic chemicals, pathogens, the internal, the microbiome, other internal environmental factors, our immune print, the markers, early detection, precise assessment, design treatment, follow-up progress and recovery, and finally, all that should be connected to behavioral health, lifestyle, and psychological well-being of the individual. So this is the Cyrex precision medicine model. Now, even in clinical trial, as you can see from the title, that new clinical trial designs in precision medicine. And right in here, it is stated that we cannot continue with the approach of one size fits all. And now we have to do the clinical trials based on precision medicine, which 100% I agree with that. So as major components of precision medicine, the systems immunology, both humoral and cell-mediated immunity, plus the environmental factors, plus their effect on the barrier structures, plays a significant role in precision medicine. So I'm going to present to you some slides about the importance of humoral and cell-mediated immunity and with the involvement of barrier structures in precision medicine. So let's start with intestinal permeability, a test developed by me, patented by Cyrex, where we measure antibodies as part of humoral immunity against lipopolysaccharides, bacterial toxins. And if antibodies, especially IgA, is elevated, indicates permeability and dysbiosis. Antibody also are measured against actin and actomyosins. If IgA is elevated, indicates epithelial cell damage. Finally, we measure antibodies against tight junction proteins, occludin zonulin. If antibodies are elevated against occludin zonulin, especially IgA, that indicates damage to the tight junction proteins. One of my colleagues, Dr. Karazia, very elegantly looked at several hundred patients from Cyrex who the doctors performed this array 2 antigenic permeability assay on their blood. Of course, some of them were positive, some of them were negative. Then they looked at autoantibody, presence of autoantibodies against different tissues in both groups, one group with leaky gut, the second group with no leaky gut, and found that the group with leaky gut had 3 to 30-fold increase in the odds of detecting elevated autoimmune target protein antibodies, meaning there is direct relationship between leaky gut and autoimmune disease. And I'm just showing you one slide from the findings that, for example, myelin basic protein involved in neuroautoimmune disorders such as multiple sclerosis, tubulin, the same thing. S-alloganglioside, also in neuroautoimmunity. That the red is the level of antibodies in individuals with positive zonulin acridine antibodies or leaky gut, and the blue is the one with negative antibodies to zonulin acridine, meaning no leaky gut. So in all the cases that we see higher elevation in antibodies in the group with leaky gut in comparison with no leaky gut. Now, we already know that autoantibodies, when antibodies are detected, like the one Dr. Karazian detected, that doesn't mean the patient is having right now autoimmune disease. That is biomarker that the patient may develop autoimmune disease in the future. And that's why I'm presenting to you this article with the title of that development of autoantibodies precedes clinical manifestations of autoimmune diseases. And in this slide, in this figure, in this table, very well summarized that certain autoimmune diseases, antibodies, for example, in the case of multiple sclerosis, 3 years before the full onset of autoimmune disease appear in the blood. In some cases, 7 years, like in Sjogren syndrome. In some cases, 10 years, like type 1 diabetes, anti-GAD65 antibodies, other antibodies. And finally, in one case, anti-mitochondrial antibodies was found in the blood 19 years before the full onset of primary biliary cirrhosis. So, ladies and gentlemen, it seems that when antibodies appear in the blood, there is a window of opportunity for intervention. In relation to cell-mediated immunity, this is a very nice slide that's summarizing the cell-mediated immunity and humoral immunity, actually. So when we get exposed to a virus or bacteria or parasites, the macrophages, antigen-presenting cells, will take up that virus or bacteria. But because the virus or bacteria is a large structure, these vacuoles full of enzymes, after taking the macrophage, after taking it inside, break down the virus or bacteria to very smaller size proteins. We call them antigens. And those antigens will be presented to T cells. T cells produce certain cytokines. Cytokines activates cytotoxic T cells, and the cytotoxic T cell goes after viral infected cells and destroy it. Simultaneously, the same T cell produce different type of cytokines, activating the B lymphocytes. And activated B lymphocytes become plasma cells, and plasma cells produce antibodies against the virus or original virus or bacteria. Now, the antibodies bind to the virus if in case the cytotoxic T cell could not eliminate the viruses entirely. Now the antibody bind to the virus, and one more time, the macrophages go after this complex and destroy them completely. And that's how the body becomes victorious through collaboration between humoral and cell-mediated immunity. Of course, a type of cells is going to stay in the body. It's called memory lymphocytes. When in the future, for the second time, for the third time, we'll get exposed to the same bacteria or virus, immediately they are going to react to that and will produce antibodies, and this process of elimination of the virus will continue. So as you can see in this figure, that the immune system in people is as diverse as height, beauty, intelligence, and other human features. Our genomes, our lifestyles, and our exosomes affect our immunotype. And these immunotypes could be determined by a very sensitive method called flow cytometry. There are reagents called monoclonal antibodies. The monoclonal antibodies can stain the membrane of different lymphocytes in different colors. And with the use of computer, and the flow cytometry itself has computer, and it counts close than 20,000 cells within a minute and will give us the percentage of each cell type with a high reproducibility and accuracy. And these reagents provided by companies such as Becton Dickinson and Coulter have been validated for blood up to 48 hours old. Why am I mentioning this? Because one of our colleagues sent an email to me saying that I have a friend who is an immunologist, and he believes that blood should be drawn absolutely fresh, and within hours, an hour or 2 or 4 hours, then you should measure the lymphocyte subpopulation. And so my answer to that colleague is that your friend probably is working in the university. He never worked in clinical immunology laboratory. In clinical immunology laboratory, we are using validated reagents for blood. Even at Cyrix, we are using mainly blood 24 hours old. But the reagents being validated for blood up to 48 hours old, and therefore you can get very reliable test result using flow cytometry. So this is what we are measuring by flow cytometry. The T cells, the B cells, the ratio, helper cells, cytotoxic cells, CD4, CD8, their ratio, which all this done so far in some laboratories, but Th1 and Th2 is unique to Cyrix, and their ratio. Treg and T-helper 17 are unique to Cyrix and their ratio. The natural killer cells, these two also is done in some laboratories, but the others also are unique to Cyrix laboratories. So by looking at this, and by this exclusive immunophenotyping, or this exclusive immunophenotyping can help identify individual with possible immune deficiency, immune overactivity, infections, inflammation, autoimmunities, allergies, asthma, hypersensitivities, and cancer. So the question is, why should you use the lymphocyte map? Because LMAP can detect abnormalities at the pre-disease stage, exactly like antibodies, because these two are part of the immune system, humoral cell-mediated immunity, work together. So abnormality in lymphocyte map also could be detected many years before the onset of the disease. Also, abnormalities could be detected at active stage and also at the progressive stage of the disease. So detected abnormalities in the pre-disease stage provides window of opportunity for early intervention, like predictive antibodies. And also during active stage of the disease, an abnormal lymphocyte map can help practitioners to design personalized treatment protocols for their patients. For example, if Th1 is abnormal, you have to give specific treatment for that. If Th2 is abnormal, that deserves completely different treatment. or T cells or B cells, the same thing. So after treatment, also follow-up, LMAP can help practitioners to monitor the recovery progress of their patients and to see whether or not the medication used on the patient was effective or not. So those are the reasons. I have in my possession at least hundreds of articles where connect abnormalities in lymphocyte map with different autoimmune diseases. So I decided just to choose one, but there are many others if you would like to read. So in this case, they look at pre-disease stage of lupus. They did flow cytometry. This is research laboratory, by the way. They found that the number of CD4 cells were highly elevated. The number of T helper 1 cells were elevated, but the number of regulatory T cells, which can regulate and balance the immune system, their numbers were decreased. So we call this double whammy because the autoreactive lymphocytes are high, and the one which are supposed to suppress the immune system and keep the immune system in a balanced state, their numbers are low. So this is one of those articles. Similar to this, I'm going to present to you a case that 60-year-old female with brain fog, extreme constipation, previous diagnosis, Hashimoto's, thyroid autoimmunity, breast cancer, and breasts were removed years ago. The doctor ordered biomarkers of humoral and cell-mediated immunity, meaning array 2 for leaky gut, array 5 for autoimmunity, and map cell-mediated immunity. And the doctor decided based on this summary figure, the question is, if a patient is coming to you with all kinds of symptoms, where to start? So my recommendation always has been, you start with essential barrier, such as array 2, 20, and 22, but or you start with leaky gut. Then you start with immune health, the lymphocyte map. If any of these are abnormal, then you go for multiple autoimmune reactivity screen to check for autoimmunity. And that's exactly what the doctor did. The results of array 2 intestinal antigenic permeability increase, as you can see, elevated actomyosin IgA, simultaneously elevated acridine zonulin IgA, meaning damage to the tight junctions. And then lipopolysaccharides IgA is elevated, meaning dysbiosis and probably these bacterial toxin causing damage to the structures, gut structure, resulting in inflammation and autoimmunity. And by the way, my interpretation always is the more significant antibodies in this array, first is IgA, the more significant, because in the gut, is IgA is more significant, followed by IgM and then by IgG. But in this case, all three IgAs are elevated. So in addition, the doctor ordered lymphocyte map. Interestingly, if you look at these parts of CBC, for example, when you order CBC, you see everything is normal. As part of a yearly checkup, if you don't order lymphocyte map, you're not going to find any abnormalities that I'm going to talk about. So first, elevation in person T cell, okay? Because the systems immunology is connected. All the components of systems immunology is connected with each other. And lymphocyte map is one of the best examples of systems immunology when one item like T cell is elevated, that elevation causes decrease in other numbers. But first, let's look at this increase in percent T cells, probably due to another type of percent T cell should be elevated. And you see right now, CD4 is elevated. So that's correlate with this. But CD8 is low. So that's, and then the ratio between CD4, CD8, 6.1. The ideal for me is 2 to 2.5 and not higher than that. And patients with inflammation autoimmunity usually have high CD4, CD8 ratio. And we should not be surprised because this patient also, not only breast cancer, is suffering from thyroid autoimmunity. Then when we look at T helper 1, which are part of this T cell, also are significantly elevated, but T helper 2 are normal. And because elevation of T helper 1 with normal T helper 2 results in abnormal Th1 and Th2 ratios. So finally, when we look at the next page, the regulatory T cell are low. So high Th1, low regulatory T cell, very similar to the article that I showed you before in relation to lupus. We see that autoreactive lymphocyte numbers are high, the one that are attacking our tissue, but the one like policemen trying to protect us against autoimmunity, their numbers is low. Okay, the numbers are low. And finally, the natural killer cells, but at least these NK cells, CD56 and CD16, are within the normal range. Okay, meaning even if the patient had cancer in the past, right now he has two types of soldiers that fighting against cancer cells. And that's how on daily basis, natural killer cells eliminate tumor cells from our body. But being more specific, there are additional 4 types of NK cells. Their numbers are very, very low. So that is how the lymphocyte map works. If one type of cells are elevated, other type of cells may suffer from that. And because total number of cells or percentages should be 100%. And when one type of cell is elevated, the other type of cells could be lower than normal. And in this case, Treg cells and some NK cells are very low. So the doctor, based on abnormal leaky gut and abnormal lymphocyte map, which supports inflammation and autoimmunity, decided to order multiple autoimmune reactivity screen or array 5. And the abnormalities which were detected was ASCA and ANCA. ASCA is antibody against Saccharomyces cerevisiae, and ANCA is anti-neutrophil cytoplasmic antigen, meaning in the gut, the neutrophils became highly activated. So we should not be surprised because this patient is having also leaky gut. Finally, thyroid peroxidase antibody, which confirms the findings based on the history of the patient. And the other antibodies, including neurologic antibodies, all of them were within the normal range. So I would like to share with you some articles published in different journals about dietary factors in addition to medications, which probably you are prescribing. But certain diet can help to bring down the levels of thyroglobulin and thyroid peroxidase antibodies. And in this article that they talk about high consumption of fruits and vegetables, dried fruits, nuts, muesli, And that kind of eating habits or lifestyle resulted in lower levels of antibodies against thyroid peroxidase and thyroglobulin. And there are many more articles similar to this. Based on abnormal humoral immunity, meaning array 2 and 5, elevated actomyosin IgA, elevated occludin zonulin IgA, elevated lipopolysaccharide IgA, elevated ASCA and ANCA, elevated TPO, the patient was treated for leaky gut, thyroid autoimmunity, and elevated ASCA and ANCA. And just a comment in here that elevation, especially of ASCA, which is anti-Saccharomyces cerevisiae antibody, deserves yeast-free diet and also removing fermented food from the diet, because those Saccharomyces and even Candida is used for fermentation of food. Leaky gut and the ingredients that help treat it. This is a fantastic article that I would like to share with you also. Lots of items are mentioned. So they recommend FODMAP diet, probiotics, vitamin A, vitamin D, glutamine, arginine, polyphenols, medical herbs, mushrooms, and other food sources. But I did summarize it in here for you. That started from glutamine, red cabbage juice, and many others. So if you'd like to, please print it for yourself and share it with your patients. But when you have all these items recommended for repairing the gut or leaky gut, doesn't mean you have to use all of them. I know some doctors are using glutamine, they are using berberine, they are using resveratrol, combination 2, 3, or 4, but it's up to you to decide which one of these to use for your patient. So then, based on abnormal cell-mediated immunity, elevated CD4 CD8 ratio, elevated Th1 Th2 ratio, low Treg, low NK cells. So the patient was treated for LMAP abnormalities. And one of those was because CD8 were low and CD4 were high, we need to increase the number of CD8 cells. And unfortunately, we don't have that many items. One of them is BCG vaccination, peanut agglutinin, vitamin D, and then 5 milligram per day DHEA. However, also, I read this article in the journal called Neuroimmunology. CD4 CD8 ratio during this monoclonal antibody treatment in multiple sclerosis. I think that is another name for this is Tysabri, which is medication for treatment of patients with multiple sclerosis. But what was interesting to me that this monoclonal antibody increases the number of white blood cells, increasing the number of B cells, also decreasing the number of CD4 cells, which was elevated in our case. And so that is going to decrease the level of CD4 CD8 ratio, and therefore can downregulate or can bring down the activity of autoreactive lymphocytes, which are attacking our tissue, resulting in autoimmunity. So monoclonal antibody used for treatment of multiple sclerosis is useful in increasing the number of white blood cells, B cells, and bringing down the number of CD4 cells and increasing the number of CD8 cells. Now, Th1 was elevated, right? Th1 was highly elevated. Now, for that, we need to increase the number of Th2 in order to reverse or balance the ratio. Again, resveratrol, zinc, fish oil, EPA, DHA, and many more. So please use some of these if your patient is having high Th1. Natural killer cells and cytotoxic cells, where some of them were abnormal, in the case. And I would like to share with you this article, which I published a few months ago in journal called Micro. In this article, I emphasize the importance of CD56 positive natural killer cells, which make up 10% of the NK cell. It's not really killing very much tumor cells and viral infected cells, but they are playing significant role in immunoregulation. Why? Because CD56 produces all these immunoregulatory cytokines. So if their number or percentage is low, patient may suffer from immune dysregulation. So phenotypic alterations reported in patients with various autoimmune and malignant diseases. So that is CD56 positive NK cell. The CD16 positive NK cell is really the real killer, which make up 90% of the NK cell. It is strongly cytotoxic against viral infected cells and tumor cells. This NK needs antibody. For example, if your body is infected with Epstein-Barr virus and you made antibody against Epstein-Barr, that antibody binds to the Epstein-Barr virus, and then the NK cell, CD16 positive NK cell, goes after it and kills the cell which are infected with Epstein-Barr virus. That's why we call that antibody-dependent cellular cytotoxicity. Binds to and kills viral infected cells and tumor cells, and increase or decrease in numbers linked to viral infections and cancer. This is one of the most important of NK cells, which was normal in our case. CD57 positive NK cells, which unfortunately for at least 20 years wrongly was used for the diagnosis of Lyme disease. So one more time, I am emphasizing that please do not use CD57 NK cells for diagnosis of Lyme disease. This is another type of NK cell, cannot be specific to a disease. Yeah. So therefore, let's learn more about this CD57 positive NK cell. It is highly mature, strongly cytotoxic, and it is actually another type of CD16 positive NK cell. It is called also memory NK cell. Their number, this is very important, increases during aging and chronic exposure to tumor cells, bacteria, and viruses. Numbers increase to destroy autoreactive lymphocytes and to prevent autoimmunity. And therefore, low numbers indicate lack of ability to protect the body against pathogens, neoantigens, and cancer. Now, combination of CD57 positive and CD16, we call them the super killers because the two different forces joined together, and this we call them super killers because they have all the ammunition CD57 having plus CD16, and actually we can say if these cells are within the normal range, probably the patient is having good natural killer cytotoxic activity. So elevation is an indication of persistent antigenic stimulation, especially viruses, correlate with slower disease progression. Blood level is depleted in inflammatory and some autoimmune disorders. Low numbers indicates lack of ability to protect the body against pathogens, neoantigens, and cancer. Another double positive cell, which is called, we call it cytotoxic T cells with CD57 positive capacity. They are NK-like cytotoxic activity. Persistent exposure to many environmental antigens induce expansion of CD57 positive, CD8 positive T cells, their number increased with aging. Why their number increased with aging? Because in aging, also autoimmunities are on the rise. And so therefore, the number of CD57 positive, CD8 positive T cells are increased in order to prevent autoimmune disease during aging. So low numbers indicate lack of ability to protect the body against pathogens, neoantigens, and cancer cells. And finally, the NKT cell is the T cell with some NK receptors on its. These are T cells that carry receptors characteristic of both T cells and NK cell. They have major modulating effects on the immune response because they secrete lots of cytokines and gives immune protection against microbial pathogens, cancer, and control of autoimmune diseases. Low numbers correlate with poor clinical outcomes in autoimmune diseases because these cells can regulate the immune system, and low numbers results in immune dysregulation and autoimmunity. How can we enhance the natural killer cells? Here, the vitamins, resveratrol, probiotics, short-chain fatty acid, blueberry, ginseng, garlic extract, oyster extract, ashwagandha, medicinal mushrooms especially, and astragalus. I'm sure you are familiar with this, but you could use just, for example, ultra-potent C or vitamin C, which I published about it 20 years ago, that 500 milligram to 1,000 milligram a day orally can enhance the numbers and the activity of natural killer cells significantly. In conclusion, I would like to share with you the cover of Nature Medicine with a focus on precision health. This special issue was devoted to precision health. They did some kind of experiment. They took groups of individuals, they put them on personalized diet versus classical diets, for example, Mediterranean diet. And then after, I think, 8 weeks or 10 weeks, they looked at some biomarkers such as hemoglobin A1C, triglycerides. They looked at gut microbiome. They looked at different indices of metabolic indices. And they found, even within just 8 to 10 weeks of personalized diet, those numbers were improved significantly, even in comparison to Mediterranean diet. So here you see that the special issue focus is all about precision health, the tailoring of preventive and treatment approaches to individuals based on their unique characteristics across different geographical and clinical contexts. So personalized dietary programs can lead to significant improvement in cardio, metabolic, and gut health, which was published in this special issue by Dr. Birmingham and the colleagues. And finally, that I sincerely believe that precision laboratory testing, accurate laboratory testing, can lead you to precision medicine and personalized medicine, and that can lead us to precision health, which is the focus of the last issue of Nature Medicine. With that, thank you so much, and I'll be very happy to answer any question that you have.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.